You eat less salt. You take your pills every single day without missing even one dose. You even walk for 30 minutes 4 times a week, just like your doctor told you. You have cut down on fried food. You try to sleep on time. You do everything right. So why is your blood pressure still high? If you're nodding your head right now, please do not close this video. Watch it till the end, because what I am about to share can change everything for you. Today, I am going to talk about 6 hidden reasons why your blood pressure refuses to go down, even when you're doing everything your doctor told you to do. And I want to be honest with you. These are not the usual reasons you hear again and again. These are the reasons most doctors never take the time to explain, because they simply do not have enough time during a short clinic visit. I promise you, reason number 4 is something almost nobody talks about, and reason number 6 is the one that surprises even people who think they know everything about blood pressure. By the time this video ends, you will understand exactly why your numbers are stuck, and more importantly, what you can actually do about it. Hi, I am Dr. John Wellness. I have spent many years working closely with patients who struggle with high blood pressure. I have seen the frustration on their faces when they follow every rule, yet their numbers do not move. And I have also seen the relief on their faces when they finally understand the real reason behind it. That is exactly why I am making this video today. Not to give you generic advice you have already heard 100 times, but to give you real answers in the simplest way possible. So here is what I want you to do. Stay with me for the next few minutes. Do not skip ahead, because each reason builds on the last one, and reason number 6 might be the exact piece you were missing all along. Before we begin, I want to ask you something. In the comments below, tell me your current blood pressure number. Just write it down, whatever it is right now. This helps me understand how many of you are dealing with this exact same struggle, and also helps you stay accountable as we go through this video together. All right, let us begin with reason number 1. And trust me, this one might already be affecting you without you even realizing it. Reason number 1, hidden salt. Let's begin with the first hidden reason. And I promise you, this one surprises almost every single patient I talk to. You probably think you are already doing well with salt. Maybe you stopped adding extra salt on top of your food. Maybe you even stopped eating pickles or salty chips or fried snacks. You feel like you have this part under control. But here is something most people never realize. The salt you add with your own hand is actually a very small part of the problem. The real danger is hiding somewhere else. It is hiding inside foods that do not even taste salty at all. Let me give you a few examples that might genuinely shock you. Take a simple slice of packaged bread, something you eat almost every single morning, without giving it a second thought. Many people are surprised to learn that 1 or 2 slices of regular packaged bread can contain more sodium than an entire small bag of chips. You are not tasting the salt, so your brain never suspects it, but your body is still receiving it. Now think about sauces. Tomato sauce, soy sauce, salad dressings, and ready-made gravies. These are often loaded with sodium to improve taste and increase shelf life. Just 2 or 3 spoons added to your meal can quietly push your daily sodium intake much higher than you realize. And then there is restaurant food. This is one of the biggest hidden sources. Even food that looks completely healthy on the menu, like a grilled chicken salad or a vegetable soup, can be extremely high in sodium. Restaurants often add salt generously, not only for taste, but also preserve the food and make it last longer in their kitchen. This is exactly why so many of my patients say something like this to me. Doctor, I do not even eat salty food anymore, so why is my blood pressure still high? And when we go through their daily meals together, step by step, we almost always find hidden sodium sitting quietly in places they never thought to check. So what can you actually do about this? Starting today. First, start reading food labels carefully. Do not just look for the word salt. Look specifically for the word sodium, because that is the number that truly matters for your blood pressure. Second, whenever possible, choose fresh food over packaged or processed food. Fresh vegetables, fresh meat, and home-cooked meals almost always contain far less hidden sodium. Third, when you eat outside at a restaurant, do not be afraid to ask for less salt in your order. Most restaurants are happy to adjust this if you simply ask. And fourth, try to cook at home a little more often, even if it is just a few extra meals each week. This alone gives you much more control over exactly how much sodium enters your body. I have personally seen many of my patients bring their blood pressure down within just a few weeks, simply by making this one change. Nothing extreme. No difficult diet plan. Just becoming aware of where the hidden salt was really coming from. Now I want to ask you something directly. Out of everything I just shared, which one surprised you the most? Was it the bread? Was it the sauces? Or was it the restaurant food? Please type the number in the comments below. I personally read every single comment, and I genuinely want to know which one shocked you the most. Reason number 2, bad sleep. Now let us talk about something that happens to every single one of us, every single night, without us even realizing its true impact. Your sleep. Most people think sleep is only about feeling fresh and energetic the next morning. If they wake up and feel okay, they assume their sleep must be fine. But sleep has a much deeper connection to your blood pressure than most people ever imagine. Here is what actually happens inside your body while you sleep. When you fall into deep, proper sleep, your blood pressure is supposed to naturally drop during the night. This is your body's built-in resting period. Your heart rate slows down, your blood vessels relax, and your entire cardiovascular system gets a chance to recover from the day. But if your sleep is constantly broken, or if you snore heavily, or if your breathing actually stops for a few seconds again and again during the night, this natural drop never happens properly. Instead, your blood pressure stays elevated, sometimes even while you are lying in bed, fast asleep. This condition has a name. It is called sleep apnea. And here's the part that truly surprises people. It is extremely common, yet the vast majority of people who have it do not even know it exists in their own body. I cannot tell you how many times a patient has sat across from me, confused and frustrated, saying something like this: "Doctor, I sleep a full 8 hours every single night. I go to bed on time, yet I still feel exhausted, and my blood pressure numbers refuse to improve." And when we finally investigate their sleep pattern more closely, we discover their breathing is actually stopping repeatedly throughout the night, sometimes dozens of times, without them ever waking up enough to notice it happening. So how can you check this yourself, right now, without any expensive equipment or hospital visit? Start with one simple question. Ask your partner or anyone who sleeps near you. Ask them directly, "Do I snore loudly at night? Have you ever noticed me stop breathing, even for a few seconds while I am asleep?" If the answer to either of these questions is yes, this could genuinely be one of the biggest hidden reasons your blood pressure refuses to go down, no matter how many medicines you are already taking. There are other warning signs too. Waking up tired, even after a full night of sleep. Having headaches specifically in the morning, right after waking up. Feeling unusually sleepy during the day, even when you slept for enough hours the night before. If any of these signs sound familiar to you, please do not ignore them. Talk to your doctor about getting a proper sleep study done. This is a simple test that can reveal exactly what is happening while you sleep. Here is something important I always tell my patients. In many cases, fixing a sleep problem like this can lower your blood pressure more effectively than simply adding one more medicine to your daily routine. Reason number 3, long-term stress. Now let us talk about something almost every single one of us is experiencing right now, in this very moment, often without even noticing it. Stress. Most people believe stress only affects the mind. They think of it as feeling worried, feeling overwhelmed, or feeling anxious. But stress is not just something happening in your thoughts. It has a very real, very physical effect on your body, and specifically on your blood pressure. Let me explain what is actually happening inside you. When you feel stressed, your body immediately releases certain hormones, mainly adrenaline and cortisol. These hormones are designed to prepare your body for danger. They make your heart beat faster, and they cause your blood vessels to tighten and narrow. This is a completely normal, healthy reaction, meant to help you handle a short burst of danger, like escaping from a threat. The real problem begins when this stress response never switches off. When you are stressed every single day, from work pressure, from family responsibilities, from financial worries, or simply from the fast pace of daily life, your body keeps producing these same hormones again and again, day after day. Over time, this constant tightening of your blood vessels keeps your blood pressure elevated. even when you're sitting quietly at home, doing nothing physically demanding at all. This is exactly why so many patients tell me something like this. Doctor, I'm not eating too much salt. I am taking my medicine exactly as prescribed. I am even walking regularly. But my blood pressure numbers are still stuck. And when we talk more and I ask deeper questions about their daily life, we almost always uncover a pattern of constant, ongoing stress that has been present for months, sometimes even years. Here is the tricky part. Many people do not even realize how stressed they truly are. It slowly becomes their normal state, their new baseline. They forget what it actually feels like to be relaxed and calm. So, let me give you one simple, practical technique. Something you can try right now, this very moment, while watching this video. Breathe in slowly and deeply through your nose, counting to 4. Hold that breath gently for a count of 4. Now release it slowly through your mouth, counting to 6 as you breathe out. Just repeating this simple cycle for 2 to 3 minutes, a few times throughout your day, can genuinely help calm your nervous system. Over time, this can help slowly bring your blood pressure down. Reason number 4, wrong medicine timing. Now, this is the reason I promised you right at the very beginning of this video. And I want you to listen very carefully, because this one genuinely surprises even patients who have been on blood pressure medicine for years. Many people take their blood pressure medicine every single day without ever missing a single dose. They are disciplined. They set reminders. They never forget. And yet, month after month, their blood pressure numbers still refuse to improve. So what is actually going wrong? In many cases, the problem is not that you are missing your medicine. The real problem is when you are taking it and what else you might be taking along with it. Let me break this down simply. Certain blood pressure medicines are designed to work best when taken in the morning. Others are actually more effective when taken at night, before sleep. Taking the exact right medicine, but at the wrong time of day, can significantly reduce how well it controls your blood pressure throughout the full 24 hours. Here is another hidden problem that almost nobody talks about. Many people take other things alongside their blood pressure medicine without ever realizing it could cause a serious interaction. This includes common painkillers you might buy without a prescription, certain cold and flu medicines, and even some vitamin or herbal supplements that seem completely harmless on the surface. These combinations can quietly reduce how effectively your blood pressure medicine works. In some cases, they can even push your blood pressure higher than it would otherwise be. There is one more surprising example I want to share with you. Grapefruit juice. Yes, something as simple and natural as grapefruit juice can actually interfere with certain blood pressure medicines. It can change the way your body absorbs a medicine, sometimes making it stronger than intended, and sometimes making it weaker than intended. Either way, this throws off the careful balance your doctor originally prescribed for you. This is exactly why I always tell every one of my patients the same thing. Never assume that all medicines, supplements, or even certain foods are automatically safe to combine with your blood pressure medicine, simply because they are common, natural, or easily available without a prescription. What should you actually do about this? Starting today. First, ask your doctor specifically what is the best time of day for you to take your particular blood pressure medicine. Please do not simply guess, and do not copy the timing that worked for a friend or family member, because every medicine and every person can be different. Second, make it a habit to tell your doctor about every single other medicine, supplement, or vitamin you are currently taking, even if it seems small, unrelated, or unimportant to you. Third, if you regularly drink grapefruit juice, please mention this to your doctor as well, so they can check if it affects your specific medicine. This one simple check, focusing purely on medicine timing and possible interactions, has genuinely helped many of my patients finally see their blood pressure numbers start to move after months, sometimes even years, of feeling completely stuck. Now I want to ask you something directly. Have you ever specifically asked your doctor about the best time of day to take your blood pressure medicine? Reason number 5, alcohol and caffeine habits. Now let us talk about two things that many of us enjoy every single day, often without ever thinking about how they are quietly affecting our blood pressure. Alcohol and caffeine. Let us start with alcohol. Many people have heard a common belief that a small amount of alcohol, like one glass of red wine in the evening, is actually good for the heart. Maybe you have heard this from a friend or read it somewhere online. But here is the honest truth. Even a small amount of alcohol can raise your blood pressure, especially when it becomes a daily habit rather than an occasional treat. Here's the part most people miss. The real problem is often not just how much alcohol you drink at once. It is how often you drink it. Having a small amount every single day, without fail, can actually affect your blood pressure more than having a larger amount only once in a while, on a special occasion. Now let us talk about caffeine. For most people, a cup of coffee here and there is generally fine. But timing plays a bigger role than most people realize. Drinking coffee right before something stressful, like an important meeting or a difficult conversation, can cause a noticeable, temporary spike in your blood pressure. And many people drink multiple cups throughout the day, one after another, without ever stopping to think about how much caffeine is actually building up in their system by evening. There is one more hidden combination I want to warn you about: mixing caffeine and alcohol together. This includes things like having coffee right after drinking alcohol or consuming energy drinks mixed with alcohol at social gatherings. This particular combination can place extra, unnecessary stress on your heart and your blood vessels at the same time. So what should you actually do about this? I am not telling you to completely stop drinking alcohol or coffee forever. That is not realistic for most people, and it is not always necessary. But I do want you to start noticing your own pattern honestly. Ask yourself these questions. Are you drinking alcohol every single day, even in small amounts? Are you having more than 2 or 3 cups of coffee daily? Are you frequently mixing caffeine and alcohol together in the same day or evening? If your honest answer to any of these is yes, even small, simple changes can make a real difference. This could mean reducing your daily alcohol intake to just a few days a week instead of every day, or spacing your coffee out more evenly throughout the day instead of drinking it all in a short window, or simply avoiding the combination of caffeine and alcohol together. I have personally seen many of my patients surprised by the results, just by cutting back a little in this one specific area, without changing anything else about their diet or exercise routine. Their blood pressure numbers began improving within just a few weeks. Now I want to ask you something directly. Do you drink alcohol or coffee every single day as part of your regular routine? Reason number 6, belly fat, not just body weight. Now, this is the final reason, and it is one that most people never connect to their blood pressure at all, even though it is something they could easily check on their own, right at home. Most people only pay attention to one number, the number they see on the weighing scale. They think, my weight looks normal, so my blood pressure should naturally be fine too. But this assumption is not always true, and it surprises many of my patients when they first hear this. What actually matters more than your total body weight is where exactly your fat is being stored. And there is one specific type of fat that is especially dangerous when it comes to blood pressure. This is the fat stored deep around your belly, wrapped around your internal organs, rather than sitting just under your skin. This deep belly fat is very different from the fat you can pinch on your arms or thighs. It is not just sitting there quietly. It is actually active. It releases certain chemicals directly into your bloodstream, and these chemicals can raise your blood pressure, even if your overall body weight looks completely normal on the scale. This explains something many people find confusing at first. Some individuals who look thin on the outside can still have high blood pressure because they are carrying dangerous fat deep around their belly. Meanwhile, some people who are a little heavier overall, but store their weight more evenly across their body, can have perfectly normal blood pressure readings. So how can you check this yourself right now without needing any special equipment or an expensive test? All you need is a simple measuring tape. Wrap it around your waist, right at the level of your belly button, and take the measurement. For men, a waist measurement above 40 inches can be considered a warning sign. For women, a waist measurement above 35 inches can be considered a warning sign. This one simple measurement can actually tell you more about your true blood pressure risk than the number you see when you step on your weighing scale. So what can you actually do about this? Starting today, you do not need extreme diets, and you do not need to starve yourself. Simple, consistent changes make the biggest difference here. Walking daily, even just 20 to 30 minutes. reducing sugary drinks and processed snacks, eating more vegetables along with enough protein in your meals. These small changes, done consistently, can slowly reduce this deep belly fat over time, often even before you see any real change in the number on your weighing scale. I have personally seen many of my patients notice their blood pressure improving weeks before their overall weight changes much at all. This happens because the dangerous belly fat often starts reducing first, even while total body weight is still catching up. Now I want to ask you something directly. Have you ever actually measured your waist size, or have you only ever paid attention to your body weight on the scale? Please type yes or no in the comment below. This might genuinely be the missing piece that nobody ever told you about before. Let us quickly go over the 6 hidden reasons together. Number 1. Hidden salt in everyday foods like bread, sauces, and restaurant meals. Number 2. Bad sleep and undiagnosed sleep apnea. Number 3. Long-term stress that keeps your body in high alert. Number 4. Wrong medicine timing and hidden interactions. Number 5. Daily alcohol and caffeine habits. And number 6, belly fat, not just total body weight. Now I want you to do just one thing today. Pick the one reason that felt most like you, and take one small step to fix it. If this video helped you, please subscribe, because next time I'm going to share natural ways to bring your blood pressure down without adding more medicine. Take care of yourself. I will see you in the next video.